Last video we have discussed about the physiology part, and before that we have discussed about the anatomical part. In today's topic we are going to have a quick revision about the general overview of the cardiorespiratory assessment for adults and pediatric patients. Number one, it's inspection. We'll do inspect about the posture, example recumbent or erect. Look for the signs of breathlessness in supine orthopnea. Tripod position in COPD. Forward lean with accessory muscle usage. Breathing pattern check for if it's adult, then it will be 12 to 20 breaths per minute. If they are infants, that is kids, 30 to 60 breaths per minute. Rhythm, regular or irregular. Breathe shallow or deep. Type thoracic or diaphragmatic. Effort labored or quiet. Use of accessory muscle usage, whether sternocleidomastoid, scalene, intercostal, indicates distress. Chest movement, whether the chest movement is symmetry or asymmetry. Equal rise of both the sides of the chest, diaphragmatic versus intercostal movement. Paradoxical movement, suggestive of flail chest, diaphragm palsy. Chest deformities, deformity and its description. If it's barrel chest, increased AP diameter in case of COPD. Pigeon chest, sternum protrudes forward in case of rickets. Funnel chest, sternum depresses pectus excavatum. Spinal deformities, scoliosis, lateral curvature, kyphosis, forward curvature, commonly in elderly TB. Kyphoscoliosis, combination of both, that is kyphosis and scoliosis. It decreases the lung volume and also the compliance. Sputum assessment, color of the sputum, type of sputum, volume, consistency, etc. So in the color, whether if it's yellow, and then it is infectious. If it's green, Pseudomonas present. It's a mycobacterium. Rusty, it's pneumonia. Pinkish, frothy, that is pulmonary edema. The type is serous, mucoid, mucopurulent, purulent. Volume, normal, which is excessive, that is more than 30 ml per day, that in the case of bronchiectasis. Consistency, watery, thickened, tenacious. Cough assessment, what type of cough it is, the type, productive cough or non-productive cough, effectiveness, strong, weak or absent. Cough reflex, present or absence, impaired reflex, increased aspiration risk. Next, these are the terms which we have discussed in the inspection. And the next thing is about palpation. Tactile firmitus, place palm over the chest, ask patient to say 99. Say 99. Increased firmitus, that is consolidation, example pneumonia. Decreased firmitus, pleural effusion, pneumothorax, obstruction, etc. Chest expansion, hands on the lower chest wall, thumbs meeting midline. Ask patient to inhale deeply, check for the symmetry. Thoracic spine and ribcage mobility, reduced in the case of ankylosing spondylitis post-surgery scoliosis. The thoracic spine and ribcage mobility will be reduced or increased. It depends on the patient's condition. And the third thing is about, first thing is inspection, second is palpation, third is percussion. In percussion, what we do, inspect for the sound, resonant, hyperresonant, dull. If it's resonant, normal lung tissue. If it's hyperresonant, pneumothorax or emphysema. If it's dull, consolidation, pleural effusion, tumor. Percuss in the intercostal space, compare sites at the same level. Auscultation, normal breath, sounds. So if it's vesicular, peripheral lung field, soft and low pitched. If it's bronchial, over trachea, loud and high pitched. Bronchovesicular, space between scapulae, sternum, moderate pitch. If it's adventitious, adventitious means abnormal sounds. Example, these are the normal breath sounds: vesicular, bronchial, bronchovesicular. Abnormal is crackles, rails, fluid in alveoli, that is pneumonia, CHF. If it's wheezes, in case of asthma and COPD, narrowed airways. If it's bronchi, coarse rattling secretion. Pleural rub, inflammation of pleura. Stridor, upper airway obstruction. In case of emergency, it will be stridor, like that, stridor. Pediatric specific considerations. Infant, observe the nasal flaring, grunting, like grunting. Chest In drawing, use gentle palpation and percussion. Auscultation may require smaller diaphragm pediatric stethoscope. Recording methods, body chart, documenting forms, graphs, and also further laboratory tests. If it's body chart, color the coded region for finding, red for dullness, blue for decreased movement. Documentation form for standardized templates, graph and tables for sputum charting, respiratory rate tracking, etc. Hope you guys have learned something new in this video. In next video, we'll be discussing about the measurement in cardiorespiratory physiotherapy.